Hello and welcome to the Laser and Light Therapies episode. The backstory to this episode is that I decided a few months ago, the time is now. I'm going to purchase a laser device for my practice, and I needed to deep dive. I wanted to know about all the different options, what type of device would work best for my practice, at least starting out. And I also just wanted to learn more because, again, that's what I love to do. I'm always wanting to learn more about this industry. And so I decided, let's just make this a podcast because at the end of the day, that's how I learn things best if I know that I have to go back and teach it. So if I create a podcast and research for this, then I will not only have really learned and have a good understanding of all the different devices out there, but also be able to share it with you guys. So sit back, relax, and enjoy the Laser and Light Therapies episode. LASER is actually an acronym, and it stands for Light Amplification by Stimulated Emission of Radiation. Basically, what this means is that these lasers are monochromatic, mono meaning one, chrome, color, one color. So they are one wavelength, one color, because of course wavelength is going to be associated with one particular color. And other things about lasers are they are coherent. So that means that the photons that actually make up that laser, the little units of light energy, are going to vibrate in perfect coordination. That's important because that means that the laser can be precisely focused. They are not bouncing around and scattering in all directions like sunlight does, for instance, or more visible light from lamps and things like that. Lasers, because they are so organized, they are very precise. And so the first laser was produced by Theodore Mamin on July 7th, 1960, and he used a ruby as the lasing medium. The first lasers really did rely on an actual crystal, and many lasers still do, which we'll get to. So he used a ruby, and basically what he did is he used a bunch of high energy flashes using flash lamps to direct light through that crystal. And because of that unique crystalline structure of the ruby, it emitted that very specific wavelength to produce a laser. And it could be, again, directed very precisely for different purposes. So obviously lasers can be used for a lot of different things. You could use it for entertaining your cats, right? Those laser pointers. It could be used in surgeries. It could be used in manufacturing. We're going to be talking about lasers in the treatment of different skin lesions. Another note is that we are going to also be talking about IPL. So IPL is not technically a laser because it uses visible light and also, I should say, non-visible too, lots of different wavelengths of light, but it's technically a light device and it is not as organized, coherent. It is not a technical laser, but many people refer to IPL as a laser device, but I just wanted to clear that up at the beginning. Okay, so let's talk about why we use lasers in the skin and kind of the general theory behind how they are treating the skin. The most common way that lasers are used to treat the skin is through a process called selective photothermolysis. So let's look at that word. Photo means light. Therm means heat. And then lysis means destroy. So basically what this term means is we are selectively using light to turn it into heat to destroy a target in the skin. So let me illustrate this for you. Let's say that you have an enlarged capillary that you want to get rid of. And some people call them broken capillaries. Really what they are, they're enlarged, they're in that papillary dermis, they're kind of closer to the surface of the skin. We don't want it there. What you can do is use a laser whose wavelength perfectly matches to the chromophore of oxyhemoglobin. So basically that wavelength is going to be attracted to the color, that red color that is found in oxygenated blood. And so that laser is going to seek out those capillaries, and that light energy, those photons that are in that laser, are going to hit that selective target and turn it into heat. All that energy, that light energy, is going to be converted into thermal energy once it's absorbed into that target. Again, that target is called a chromophore. So it's a specific color, which is what causes that laser to either absorb or not absorb into it. And so that heat that is generated through the absorption of our laser light energy is going to lysis destroy that target. And in the case of this illustration here, what would cause the vessel to actually just collapse on itself, or sometimes the blood inside that vessel would coagulate and then slowly be processed and removed by the body. But it's not just oxyhemoglobin that we are targeting. Many other chromophores are also used in the treatment of different skin lesions or skin conditions. I just mentioned oxyhemoglobin, so that's one of the chromophores, but we also have a few others. We also have melanin. So we can use specific lasers in specific wavelengths that are going to be really readily absorbed into melanin. And so again, with that selective photothermolysis process, all of that light energy is going to be converted into heat, and it's going to actually destroy those pigmented cells, which will then cause those pigmented cells to actually slough off, revealing the brighter, unpigmented cells below that will then create a more even appearance to the skin. So obviously that melanin as a chromophore is going to target hyperpigmentation, either UV-induced hyperpigmentation, post-inflammatory hyperpigmentation, in some cases melasma. Melasma is a tricky one when you are treating with lasers because melasma is very heat sensitive. So I'll mention that again, but you have to tread lightly when treating melasma with lasers. In some cases, topicals and peels may be a better option for people. But the other type of treatment that uses the melanin in our skin as a chromophore would also be hair removal. And we'll come back to those too. Okay, so we've talked about two chromophores. We're talking about oxyhemoglobin, that red color that oxygenated blood has. We're talking about melanin. We have three more chromophores that are commonly used in laser and light therapies. We also have tattoo pigment. So if you have regrets, you do not like that tattoo anymore, you might be seeking treatment for your tattoo removal. Tattoo pigments are going to be another chromophore depending on the color of your tattoo. And then we also have bacteria as a chromophore. So in some cases, P. acnes bacteria are going to be the main bacteria we're targeting here. They actually create a kind of orangey color biologically. Those are called porphyrins, and it's kind of an orangey color. And so the type of laser or light that is going to be really readily absorbed into that orangey color is going to be something in the blue wavelength. So if you're targeting acne, the blue light, we've heard of blue light in the treatment of acne, that can be really helpful. But also targeting sebaceous glands can also reduce oil production, which we'll get to. And then the last chromophore that we're going to be targeting is water. So obviously we have water all over our bodies. What is it? The statistic that something like 97% of our tissues of our body is made up of water. Don't quote me on that. It's something like that. And so we can, depending on the depth, we can actually target different layers of the skin to have a rejuvenating effect. So you can use water as a chromophore to treat and create selective wounding in the dermis, which is going to elicit that wound healing response, leading to new collagen creation, collagen remodeling. That's going to help with wrinkles. And then also in some cases, you could use water as a chromophore to also reduce hyperpigmentation by targeting those epidermal cells. So in kind of a recap here, 5 main chromophores that we are using: oxyhemoglobin, melanin, tattoo pigments, bacteria, and water. So let's talk about laser safety. You might have heard that not all patients are a good candidate for a laser treatment, which is absolutely true. And it's going to depend on many, many factors, but really this all centers around the Fitzpatrick scale. If you're an esthetician, you know the Fitzpatrick scale forward and backwards, but let me just give you a brief overview for those who may not be familiar. Fitzpatrick is a scale of 1 to 6, and it is a way to categorize patients by their skin tone. So a Fitzpatrick 1 is a very fair-skinned individual, that kind of like porcelain look. They probably have very light hair, probably blue eyes, maybe coming from more of a Scandinavian, Northern European hereditary background. And then we have a 2. So I am a 2, very fair still. I'm freckly, but I can tan a little bit if I really tried over a long period of time, but generally not. I don't tan very well. I burn easily. That's what makes me a 2. 3s are going to have a little bit more melanin in their skin. So you look at someone that's a 3, they might have kind of more of a yellowy look to their skin, or I'll tell people, look at the veins on the inside of your wrist. Those that are 1s and 2s, their veins will look kind of more purpley and bluey. When you get in the 3 and 4 range, your veins will start to look a little bit more green. And a 3 is going to be able to tan. They still could burn, definitely, just like everyone can burn, regardless of your Fitzpatrick. But a 3 will more reliably be able to create a nice bronzed glow when they have sunlight exposure. They could still have blue eyes, but tending now to have darker eyes, possibly darker hair. And now we get to a 4. So 4s are going to have more melanin, easy for them to tan. So they go out into the sun without sunscreen, and 15 minutes later, they have a nice bronze to their skin. It's definitely harder for them to burn, but they can burn in the sun. They generally will have dark hair, darker eyes, and they're going to be some different hereditary backgrounds. Could be Native American, Hispanic, certain Asian, Indian populations, Mediterranean background. So people whose ancestors came from more equatorial, sunnier places are going to more naturally have that propensity to create melanin. And that really is what the Fitzpatrick scale is all about. It's about your ability to create melanin, to create a tan when you are exposed to inflammation. Okay, so that's a 4. Then we have a 5. So darker skin still, even more likely to create that nice bronzed glow, less likely to burn. And then that brings us to a 6, which would be someone of African ancestry or some South Asian ancestry. Very dark skin. You still can burn. It's just harder to see it on the skin, but you are very, very active melanocytes. So in response to any kind of inflammation, your higher Fitzpatricks, especially your 6s, will create hyperpigmentation and create more melanin as a response, even if it's not sunlight, right? So this whole response, this creation of melanin in response to sunlight, that has a protective effect for us, right? Because melanin does protect us from UV. But the problem is that when a higher Fitzpatrick comes into contact with any kind of inflammation, right? They burn themselves on the oven. I just burned myself last week on the oven. Their skin will create hyperpigmentation in response to that injury, even though that really doesn't have a protective effect, right? Or they get an acne breakout, and then as it heals, it will then leave a brown mark of hyperpigmentation afterwards. So what we're concerned about is that with treating a higher Fitzpatrick, so for the rest of this podcast, if I say a higher Fitzpatrick's, I'm talking about 4, 5s, and 6s. When you're treating a 4, 5, or 6 with a laser, we are concerned that we may accidentally introduce too much heat to the skin that then will have that wounding effect and stimulate their melanocytes to create hyperpigmentation in response. And in some cases, we can even create hypopigmentation when we've removed all of those pigmented cells and maybe even possibly damaged some melanocytes as well. Generally, hypopigmentation is not permanent. It does come back. There are some therapies involving UVB exposure, actually, which is a little spooky to me, but there are treatments that bring back pigment. And most of the time, we are able to bring back pigment if there is accidental hypopigmentation in response to a laser treatment. But generally, it's our higher Fitzpatricks that are at risk for both hyperpigmentation and hypopigmentation when we use incorrect settings or we have an inexperienced clinician providing that treatment. So what type of a patient does a laser technician love to see walk through the door? It is someone with fair skin, but dark pigment, dark unwanted pigment, basically. The ideal candidate for say laser hair removal is someone of Fitz 1 through 3, but they have dark hair or they have dark pigment, because that laser will not be confused between the target, which is that dark pigment or that hair bulb that has a lot of melanin, and the surrounding tissue. But if you have someone that's a higher Fitzpatrick, that laser might get confused between that baseline skin color, that tissue, healthy tissue that we want to preserve, and the target chromophore. And so that is why we have to really pay attention and make sure that you are making an educated choice about who is performing your laser treatments. And in some cases, a practice may not have the type of laser that will be able to treat you. The conversation really should be about, look, this laser, I can treat you with it, but maybe I'm just not able to use settings on it that are going to get you the best bang for your buck, right? We might have to do way more treatments, like triple the treatments of other lasers, because you're Fitzpatrick, right? The clinician needs to be honest in that case that, this isn't the best use of your money. I think you should seek out a different practice that has this type of laser that will be better suited to your needs. And the other flip side is that, there are clinicians out there that don't want to turn down business, right? So they're going to say, yeah, we can laser everybody. But then, as we just talked about, that is just not ethical in some situations and can actually cause injury to that patient. So make sure that you are choosing a practice that has that ethical mindset, and has good reviews. You trust them, because there are many considerations to take into account when you are choosing a laser technician and a laser treatment for your skin. Okay, so for the rest of this episode, I am going to be talking about 5 or maybe 6. Let me look at how many I have. I have 6 different chromophores. So I'm going to be separating the types of devices and the types of treatments by the chromophore that we're targeting. And we're going to be covering how to treat vascular lesions with that chromophore of oxyhemoglobin, hyperpigmentation with that chromophore of melanin. We're going to be talking about hair removal, which is also chromophore melanin, and then tattoo removal and acne are going to be next. And then we're going to end with skin resurfacing and rejuvenation. So let's start at the very beginning. I opened up this episode by talking about vascular lesions. We don't need to go all the way back into detail about this, but remember, oxyhemoglobin is that compound that is found in oxygenated blood. It has that red color. And so when we are looking for a laser or light therapy to target that oxyhemoglobin, we need a wavelength generally between 580 and 590 nanometers. Those laser and those wavelengths are the perfect wavelengths to really absorb effectively into that oxyhemoglobin, causing that tissue destruction, that vessel collapse. And I've actually performed these treatments before in several different settings, and it is so fun to actually see that vessel just disappear before your eyes. It's so satisfying. So let's talk about the different types of lasers that you can use for this. I would say the kind of gold standard out there, the most popular one in our industry at this time, would be the V-beam. A V-beam is a pulsed dye laser by Candela. A pulsed dye laser basically uses a liquidy solution through which to force that light energy through to create that particular wavelength. That's in contrast to using a solid state laser. A solid state laser would be using a crystal like ruby or alexandrite. So V-beam is one of the most popular, and that is going to be a really effective treatment for individual vessels, as well as kind of removing generalized redness and that diffuse redness that is common also and a concern. When you just have that kind of diffuse redness, really what it is a bunch of kind of micro vessels that you can't see individually, but are contributing to that kind of ruddy, that red look to the skin. Then we have a newer player in the field, which actually is the laser that I brought in to my practice. It's the ADVA by Reveal. ADVA uses a wavelength of 589 nanometers and can be used for, again, removing that kind of diffuse redness as well as targeting individual lesions. Other types of lasers that are great would be a KTP laser. This is a solid state laser, and it uses a particular type of crystal, and I don't even know if I should attempt pronouncing this. I'll try it. Neodymium yttrium aluminum garnet. Okay, so that's the ND YAG. And then you put a KTP crystal, and that also stands for a different crystal. I'm not going to try that one. And you basically use that second crystal to double the frequency of the ND YAG. You're going to hear ND YAG a lot. So that is that long crystal that I attempted to sound out. Which is a solid state laser. It produces a 1064 wavelength. When you use the KTP crystal, it's going to actually cut the wavelength in half. Or another way to say that is to double the frequency. So you wind up with a 532 nanometer wavelength when you do that. So KTP lasers have really good absorption into both melanin and hemoglobin. One of the downsides, though, is that that 532 is really only for fits 1 through 3. So higher fits is your 4, 5s, and 6s. Generally are not candidates for using a KTP laser. And then another type of device that we haven't really talked about very much yet is an IPL. So IPLs are extremely popular in the industry. And an IPL is actually not a true laser. It stands for intense pulse light. And so it uses 1 or 2 flash lamps in a big handpiece. These have really big, kind of bulky handpieces. You might have seen them. And then kind of a flat area that is pressed to the skin. And you want it to be very flush and parallel to the skin. The angle is important. And the angle is important, especially, for all laser treatments, it's important, but especially for IPL, because as I mentioned earlier, light is not as coherent and precise as a laser. And so if you are not holding it at that perfect perpendicular angle to the skin, your treatment may not be as effective. There are some devices out there, like the one I'll keep mentioning, which is definitely the leading one in the field, is the BBL Hero by Cyton. That one apparently has some technology that can kind of sense your angle and correct it if it's not perfectly flush. Again, you kind of have to take everything that laser companies say with a grain of salt when it comes to all of their bells and whistles, but that is pretty cool if that really does help with the treatment efficacy. For sure. And so going back to how an IPL actually works. So you have 1 or 2 flash lamps in this big bulky handpiece. And instead of having just one wavelength that's emitted, as is the case with a laser, the IPL is actually going to selectively filter out the wavelengths that are not needed. And so basically, you're going to be using many, and a wider range of wavelengths all at the same time, as opposed to using just one, which may have 1 or 2 target chromophores. So you can treat many different conditions all at the same time with an IPL, depending on the Fitzpatrick and the targets that you're going for. So there are pros and cons to using a laser versus an IPL. So let's talk about kind of the pros of using an IPL. IPLs, again, they treat many different things all at the same time because you can use a wider range of wavelengths. Even you could use a range of wavelengths here on the spectrum and then skip these and then come up here to target water and target melanin, target your oxyhemoglobin here. So you can do a lot at the same time. Treatments are pretty fast. So I've heard of practitioners doing a full face in about 15 minutes. So that's pretty great. However, there's always a flip side, right? In the past, I've had several IPL treatments and I was not super impressed with the results that I got. I didn't really see a difference and they were very uncomfortable. The kind of the memory I have, if I think about what it felt like to receive an IPL treatment, it felt almost like someone took a hot pan just directly off the stove and just seared my chest with it or seared my face with it. So it's very hot. It's almost like you're just throwing tons of light and heat energy at that skin and hoping that some of it sticks to your targets, right? But you are getting kind of a lot of collateral thermal damage because of that. And that's also what makes IPLs a little bit more risky for your higher Fitzpatricks. Generally, IPLs are going to be awesome for your Fitz 1 through 3. When you get to your Fitz 4s and 5s, you need to use more caution. And of course, your IPL device will come with presets that you can use, but most burns that would mean accidental hyperpigmentation or hypopigmentation are going to be caused by IPLs out there. So that is definitely a downside. Pros of using an IPL also is a bigger surface area. So your handpiece generally is going to be, I've seen that some of them, they can get pretty big. So you're using these kind of bigger treatment zones all at the same time. But again, that can also be uncomfortable. And generally what I've heard out there, I've heard of a medical director kind of sharing his philosophy about how to treat, let's say, how to treat rosacea. So if someone walks in with tons of enlarged blood vessels and capillaries, he liked to start them on a few IPL treatments first, just kind of knock out that baseline redness, and then he would switch to a KTP laser that we just talked about, that 532 nanometer, for more precise detail work. So then once you knock out that baseline redness, or you've reduced it, you can actually see those individual vessels more clearly. And then you're able to really target them with the more precise laser, right? Because lasers are always going to be more precise, right? But you wouldn't want to start off tracing individual vessels when you have that baseline redness. So that was just one philosophy. Every practice that you go into is going to have a different philosophy about treatment based on, and a huge component of this philosophy will be based on which devices they have. If they have one device, then the protocol is going to be using that device. But depending on the type of practice, there could be a case for buying a package of a few different modalities to get you to that end result. And while I'm on the topic of kind of what lasers feel like, for the most part, they're not super fun. You definitely do feel, some people will say it's like a rubber band snapping on your skin. I don't quite resonate with that. I almost feel like it feels a little bit like a needle being inserted into the skin. But the really great thing about it is that it's fast. That pain is not constant. It's just boom, and then it's over, and then boom, and then it's over. Generally, it's well tolerated by people. But you definitely have to kind of steel yourself and say, okay, this is not a relaxing facial here. This is going to be more of a treatment focus. I just received a laser treatment last Thursday with a dual wavelength, the ADVA treatment, which is a 589 and then a 1319, which we'll get into. And the areas where you have more of that target chromophore, so I have more pigment on the driving side of my face, on the left side of my face, I felt a lot more pain on this side than I did the right side. And then when we went around the mouth, I have a lot of actually little vessels and bits of erythema from acne breakouts. And so I felt quite a bit of heat and almost like the little needles going in as it was selectively targeting those chromophores. But if you have, say, a portion of your skin that really doesn't have anything for that laser or light energy to absorb into, it's just your baseline tissue, you don't have pigment, you don't have redness, then in some cases it feels just quite comfortable. So really you'll feel it more when it's doing more. And that also kind of helps, right? So it's not as if, you're just feeling pain to feel pain. If you are feeling more pain and discomfort, it's because it really is targeting those unwanted targets in the skin, like vessels or hyperpigmentation. Okay, so I got a little off track there just because we were talking about IPLs, but we are on the first of 6 chromophores. We're talking about vascular lesions. So just to recap, we can use pulse dye laser. That would be like the V-beam by Candela. The ADVA is also a form of a pulse dye laser. With a 589 wavelength. You can use the KTP laser, so that uses 2 different crystals to produce a 532 nanometer wavelength, and you can target both melanin and hemoglobin with that. Also, the ADVA with the 589 will also absorb into melanin as well. Although maybe not quite as readily as the 532. And then we got off track here with the IPLs. So IPLs, you can set to specific wavelengths to treat the oxygenated vessels, the red ones. You can get really great results with that too. However, like I said, I've received several IPLs, and the results that I get from actually using the pulse dye laser, the ADVA, and I've also had the KTP used on me, were in my experience superior to IPL. But again, really depends on the device that's used and also the skill level of the practitioner. That will play a huge role in the type of efficacy that you get. So let's say that you have rosacea and you have a lot of just redness the kind of hallmark of rosacea, that central third of the face across the cheeks and the nose, you have quite a bit of enlarged blood vessels and capillaries. You blush easily, and you want to seek laser treatment to reduce that. So generally, if you are using either an IPL or a pulse dye laser like the ADVA, then generally the recommended treatment would be to do, I would say, 3 to 5 treatments 1 month apart. And after that series, you should see a pretty dramatic difference in your redness. Of course, you will still have some redness, right? But you will see a big reduction in your redness, and some of those vessels, like I said, will just be bye-bye, which is so fun. After that, as we know, our body is not static. So if you have that propensity to create new capillaries, as is the case with rosacea, you will need touch-ups. So once or twice a year after that initial series, it is usually recommended to come in for your touch-up laser treatment to keep your skin in check. Moving on to our second chromophore of the day. Our chromophore in this section is going to be melanin, because we are talking about treating hyperpigmentation. So there are a few different types of devices that are helpful for treating hyperpigmentation. The KTP, which we just talked about with a 532, is great for our lower Fitzpatrick's. And IPLs are really widely used for this as well. In the past, when I've received treatments to treat hyperpigmentation, areas of darker hyperpigmentation, when treated, will actually turn very dark and actually people say it resembles coffee grounds. It kind of turns black, and then about 3 to 5 days after your treatment, it will start to slough off. And so you don't look super cute when you are sloughing off coffee grounds from your face, but afterwards, you will have a clearer, more even toned complexion. So it's all worth it. I did get treated last Thursday, like I said, with my ADVA, which is the 589, and it does have absorption into melanin as well. And so you can treat melanin and hyperpigmentation using the 589 wavelength. I actually had this lesion under my eye. For those that are just listening, I'm pointing to an area under my eye, and it did darken instantly. And it actually, just the bottom half of this little lesion is kind of darker, and it's been sloughing off ever since. So it's kind of honestly fun to see that process take place, because okay, something actually happened there. And that generally is what is going to happen. If you're spot treating, there are different techniques that you can use with any device where you're using slightly different settings, and you are just literally spot treating an area of pigment, or in some cases, our particular vessel, like we talked about in the last section. So you can use the IPL, you can use the KTP, you can use the pulse dye lasers like the ADVA or the V-beam, and then any laser that offers resurfacing. So that's going to be in our last section when we talk about chromophore using water and resurfacing and rejuvenation. But any laser that is going to cause that sloughing of that epidermis will also reduce hyperpigmentation in much of a similar way that peels do. The kind of philosophy is pretty similar. So you're basically just removing kind of all of that tissue, or maybe just portions of it, which will cause that kind of lightening effect as the damaged cells are actually going to shed from the skin. So when you are receiving treatment for hyperpigmentation, generally the recommendation is, again, similar to rosacea. It would be 3 to 5 treatments up front, and then 1 to 2 treatments per year following that to maintain your results. And, just like when we talk about peels, the best time to do your lasers would probably be in the fall, because you're not going to be exposed to as much sunlight. That will kind of cause you to backtrack a little bit, because once you go out in the sun, those spots will come back. I like to remind my clients that, sometimes they have this idea that, okay, I'm going to go get a laser treatment and then I just will never have that spot again, or I won't have that freckle again. It really does not work like that. If you go out into the sun unprotected, that pigment is going to come roaring back. So generally, fall, winter are a great time to do treatments, just because it also is kind of fun to see your results. But you could do laser treatments year round, especially if you are really good at wearing a hat, reapplying your sunscreen, using those post-treatment protocols to the T to ensure that you get a good result. So lasers and IPLs are great for 2 of the 3 of the major types of hyperpigmentation. The first type of hyperpigmentation, the most commonly seen type that is definitely a big player in lasers, would be are UV induced. So those would be sunspots or freckling. Generally, you see sunspots, UV induced hyperpigmentation more on the left side of the face. They're going to be on kind of the higher points of the face, the upper cheekbones, along the nose, up on the forehead. Those of you who might be seeing the video, on my chest, I have kind of an area of UV induced hyperpigmentation. You can almost imagine where my t-shirt has ended, like if I was wearing a V-neck t-shirt over the course of a decade, right? Or more, where I've received that sun exposure. Generally, again, if you are a lower Fitzpatrick, you're a Fitz 1 through 3, and you have dark spots, you're the perfect candidate for those more aggressive laser treatments like a KTP laser, or more aggressive settings on an IPL. You will get great results. When you are higher Fitzpatricks, the clinician is going to have to turn down those settings a little bit. You're going to have to be more cautious with treating you just because your baseline color is more similar to the target. And so we don't want our laser, again, confusing your normal skin tone, that base color that you have, with our target spot. That's where accidental laser burns can happen when protocols are not strictly followed. And so in some cases, things like peels or other topicals might be recommended over using the laser treatment if you are a higher Fitzpatrick. Another form of hyperpigmentation that can be treated with lasers would be post-inflammatory hyperpigmentation. This would be the actual pigment that occurs after trauma or injury to the skin. So let's say that you had a surgery and that incision actually left pigment behind. You may be a candidate. Or acne, I would say, is one of the most prevalent ones because, like for me, if you're a Fitzpatrick 1 through 3, you get an acne breakout. What's left behind for me is simply red tissue. It's called granular tissue. And it's just a little excess vascularity where that injury occurred because our body actually creates new vessels to facilitate the healing process in that area. After the healing process is complete, which is typically 3 to 6 months, that redness generally does go away and then I'm back to normal. However, if I was a higher Fitzpatrick, I was a 4, 5, or 6, that area then would actually be left with brown pigment, that melanin afterwards. That's true PIH. So the redness we see is PIE, post-inflammatory erythema, and that does go away with time, but higher Fitzpatricks are more likely to develop the true hyperpigmentation as well in response to that trauma. So again, let's kind of look at this a little bit deeper. If you have a lot of PIH, that probably also means you are a higher Fitzpatrick as well, because higher Fitzpatricks are more likely to develop hyperpigmentation, PIH, which is also why we need to be more careful with you if you are a higher Fitz, right? So if that is the case, then depending on the device being used and the wavelength being used, you may or may not be a candidate. The last type of hyperpigmentation is melasma. And melasma is a super tricky form that's also known as hormonally induced hyperpigmentation. Women are more likely to develop melasma, although men can develop melasma. I might just have a totally separate episode on melasma. Basically, it's going to be more patchy areas of pigment and symmetrical, almost like a butterfly. So if you have a big patch on one cheek, you'll have an almost identical patch on the other. And when it comes to melasma, Fitzpatrick's 4, 5s, and 6s are more likely to develop this condition, which also means you are at higher risk for complications with lasers, like we just mentioned. But the other complicating factor is that melasma also exacerbated by, and that is at the core of laser treatment, right? Because we are selectively causing light energy to turn into heat to cause tissue destruction. So our concern with melasma is that we may actually make it worse by using a heat-based light therapy like lasers. So you can treat melasma with most devices, but you're going to notice if you're the practitioner, you are dialing it way down to treat anyone with melasma. That just means that you're just definitely going to need more treatments because you need to be more cautious and more conservative with your settings to avoid making it worse. Okay, so we've already talked about our chromophore of oxyhemoglobin. When we were talking about vessels, we talked about our chromophore of melanin when targeting hyperpigmentation. Now we're on to our third section, which is also going to involve the chromophore of melanin. We're talking about hair removal. Again, the perfect candidate for laser hair removal would be someone that's a Fitzpatrick 1 through 3, but has dark hair. And that's just because, again, that laser is not going to be confused with that base tissue, that baseline skin color, and that target. In this case, the target is going to be the hair, the bulb of that hair itself. So our hair follicles actually go pretty deep down into our dermis. And at the very bottom of that follicle is kind of a bigger bulb. That is where our hair is actually growing from. And so we're going to use specific wavelengths to really target that melanin so that the melanin in our actual hair will then absorb all that light energy, turn it into heat. And then the heat will kind of leak into that whole area in that hair follicle, and it will cause damage to the hair follicle. So the idea is that by targeting the bulb of that growing hair itself, we will create so much heat in that specific area, we're going to damage the lining of that follicle and thereby reduce the ability of that follicle to create hair in the future. And so we can do this with a few different types of devices. You could use IPL. Again, there's your IPL. IPLs do a lot, right? You could use a Ruby. We talked about Ruby. That was the first laser that was actually created. That's in the 694 wavelength, nanometer wavelength. We have an Alexandrite, which is another type of crystal that produces a 755 nanometer wavelength. And then you can also use the Nd:YAG. Nd:YAG is another type of crystal. I'm not going to attempt to pronounce that one. That produces a wavelength of 1064 nanometers. In general, that Nd:YAG with a 1064 is going to be better for your higher Fitzpatrick. So if you have a higher Fitzpatrick client who wants hair removal, it's a good chance that you're going to reach for a 1064, but you're going to have to kind of use more heat and be more aggressive with your cooling techniques because that 1064 wavelength is not as readily absorbed into that melanin as the other wavelengths are, the lower wavelengths we just talked about. So you're really just trying to heat that whole area. And so you need to be careful. Definitely use some aggressive cooling. And the hope there is that you are going to reduce the risk of accidental hyperpigmentation by doing that. So we're talking about ideal candidates, right? So ideally you have your lighter Fitzpatrick, but you have dark hair. That also means that if you are a lighter Fitzpatrick, but you have blonde or light hair, you're not going to be the ideal candidate for laser hair removal either, because your hair creates very little to no melanin. And so that would be like someone like me, like the hair on my arms is blonde. So this really is not going to respond very well to a laser because there's just no melanin in it. It's not going to have that effect that we're looking for. If you do have someone with light hair that wants help with that, you might have to look into other things like electrolysis to reduce hair growth. So to have a reliable treatment when it comes to hair removal, generally you want to do at least 6 treatments. That's what I found. And then that is to guarantee, or I shouldn't say guarantee because nothing's guaranteed, but that's going to give you about an 80% reduction. So many people in the industry are also proponents of calling these types of treatments laser hair reduction, just because removal gives you the idea that it's all going to be gone. It is hard to make sure that you're getting every single follicle, because the other part of this is that when you are treating that follicle, it is also important that that follicle is in anagen phase. So it needs to be in a phase of active hair growth. But our follicles actually go through several different stages. They're either actively growing or they kind of go dormant and then that hair falls out and then it starts again. So that's just one example of why, say, the hair on my face, like my lashes and brows, they don't grow as long as the hair on my head, right? Thank goodness, because those follicles on my face and body are programmed to stop growing, go through kind of a dormant phase, and the hair is going to fall out and then it starts again. What's unique about the hair on our heads is that this anagen phase can last for years. It has an extended hair growth length as opposed to hair on the other parts of our bodies. So if you are treating a follicle, but there's no hair in it because it's in that dormant phase, it's not going to be treated, right? Because there's no melanated hair deep in that follicle to then absorb the heat to damage the follicle, right? That's why it's so important to receive consecutive treatments, trying to catch as many follicles as you can when they're in that active growth phase. I have heard of certain clinicians, they've done, more like 12 to 15 treatments, and then they're feeling like they really don't have any hair in that area, right? And I'm saying clinicians because they are able just to, quickly treat themselves in between clients or whatever it might be. Most consumers are not going to be paying for 12 to 15 treatments. The idea behind that would be just simply the more treatments you have, the better clearance you're going to get. All right, so we talked about treating unwanted vessels and capillaries, hyperpigmentation. We just finished up with hair removal or laser hair reduction. And now we are going to discuss tattoo removal. Tattoo pigment is found in the dermis, so that's pretty deep down. And what makes it complicated, number one, is the depth, but also the fact that there are many different types of pigments that are used in tattoos. It's not just one color, right? Like melanin is generally one color or a very specific range of colors. Same with oxyhemoglobin is one color. But because tattoo inks can be so differentiated, you have to use a variety of different wavelengths in order to target them. When we're talking about tattoo removal, what's interesting is that in this case, we're actually not trying to use heat to destroy the pigment like we are with our other chromophores. In this case, it's recommended that we use something called a Q switch. A Q switch essentially is kind of like a dam that is going to intermittently block and then release that laser light. And so what happens then is you're going to kind of build up a surplus of photons behind that dam. And then when it, like a gate lifting, although that a big burst of energy and a pulse is going to be released. And when we talk about a pulse, generally they're very, very short. So most Q switch lasers are going to release them in 5 to 20 nanosecond intervals. A nanosecond is a billionth, 1/1000th of a second. So these are extremely short pulses. And because of that intermittent kind of damming up and then release of that light energy, it's going to create a huge burst of energy. And again, we're not actually trying to heat our chromophore in this instance. We are actually going to create what's called a photoacoustic effect. So that light energy is going to essentially create a shock wave in the tissue that will mechanically break apart the tattoo pigment. It will break it apart, kind of blast it into tons of little tiny pieces into the dermis. And then we're going to rely on macrophages, which are specialized cells that are a part of our immune system. Those are the ones that are kind of like Pac-Man that go around and they absorb and engulf foreign material. And so our macrophages are going to go in and actually remove those broken apart bits of tattoo pigment and clear them for us over time. So when it comes to tattoo removal, I have heard this is very painful. It just has to do with, I think, the depth and the types of settings that need to be used. I would say out of all the different types of treatment philosophies, you have to use the most unique kind of treatment philosophy when you're treating tattoo removal. Definitely you need multiple treatments for this. I've heard a range of anywhere from 6 to 12 in some cases to cause clearance. And I've honestly never seen an end result that looks just like your base tissue. You're always going to see a little something going on there. It is not 100% clearance, just like most things when it comes to our skin and our bodies. So the second to last section in this podcast is going to be about treating acne. There are actually 3 different chromophores that we are going to discuss in this section, because there are really three different ways that you can target acne, or in some cases you might want to utilize all three. And this has to do with two different targets. So we're either targeting the bacteria, the P. acnes, or they have been recently renamed actually to C. acnes bacteria. Or you could be targeting the sebaceous glands. Generally, what's happening with acne, that this definitely deserves its own podcast, is we have a proliferation of the C. acnes bacteria. They create inflammation, redness in the follicle, which then leads to tissue damage and these unsightly lesions that we know as acne breakouts, right? But what's behind that is also increased oil production. That's one of the cofactors that will stimulate acne lesions. Some people are naturally more oily, or there are certain hormones that increase oil production, notably testosterone and androgen. Depending on your gender or your genetics, you might be more likely to create more oil and therefore be more acne prone. So let's talk about targeting the C. acnes bacteria. There are actually two different wavelengths that we can use to target them. The first would be using a blue light. Blue light is actually, I think most consumers know now that blue light can be used to target acne, and that is because the C. acnes bacteria create what are known as porphyrins. Porphyrins are actual biological compounds that kind of fluoresce this bright orange color. Porphyrins are also very inflammatory. So that actually is the main cause behind what is actually leading to that inflammation in that follicle, are these porphyrins. The porphyrins are orange, right? And so what we want to direct a blue colored light at those porphyrins, which are found within those bacteria. And in so doing, that is going to absorb readily into that orange. So we're talking a 400 to 420 nanometer light is going to readily absorb into our chromophore of that porphyrin. And that is actually going to kickstart a chemical reaction, which will lead to the destruction of that bacteria. That is why in my practice, we do utilize blue light. We use the Celluma LED device, which does include both red and blue light. And so that blue light is going to destroy those C. acnes bacteria in the process that I just described. So that's number one. You could use a light device like an LED that has that 400 to 420 nanometer wavelength, or also known as a blue light, which will destroy the bacteria. And then I've also heard that some IPLs also utilize this wavelength as well. Another way that you could go about treating acne would be to target the redness. So you could actually use a pulse dye laser or a KTP laser. That would be either a 532 nanometer, 589, or 590, something like that. And you would be targeting the chromophore of oxyhemoglobin. You're targeting the red, but in this case, you're targeting the redness around an acne breakout, right? So in doing that, you're going to generate heat right in that localized area where you have the acne breakout. And that in turn is going to kill the C. acnes bacteria through heating them. So that is the theory anyway. It's not exactly known how a KTP or a pulse dye laser like the ADVA or the V-Beam treats acne, but that's the leading idea, is that, okay, what do we normally find around a follicle that has a proliferation of C. acnes? We find redness around it, right? So let's use that oxyhemoglobin as our target that will heat up that area and help to kill the C. acnes bacteria. So that's another way. So we can either use the blue light to kill the bacteria. We can use a heating effect by targeting the redness around an infected lesion. And then the last treatment philosophy you could use is to use the chromophore of water. So you could use water as a chromophore, which is going to heat kind of the deeper tissues in the dermis, and that will have the effect of actually damaging and reducing oil production, because our sebaceous glands, the glands that create oil in our skin, are found there. So if we disable or reduce their capacity to create oil, we also are going to reduce acne. And the reason why is because the C. acnes bacteria, actually their main food source is our sebum. So that's also the philosophy behind Accutane. Accutane basically reduces or removes most oil production from your skin, and that essentially takes away the main food source of the C. acnes bacteria, leading to clearance in the skin. We could use also IPL for the treatment of acne. You could use the IPL and set it to, either that 400 range, 500 range, as with the pulse dye lasers, or you could set it to more of that infrared to help reduce the oil production. The infrared would be like your 1319, 1320, 1450 nanometers. All of those infrared wavelengths, which we will talk about actually in the next section, those are going to go into your dermis where the target is going to be water. And that's where that heating and that wounding is going to happen. In this case, we are hoping to disable those sebaceous glands, leading to less sebum output, which then will reduce our acne breakouts. And so there's actually a few kind of interesting studies out there. One of them involved using 25 patients with acne that were treated with a KTP laser. KTP, again, 532 nanometers. After 6 treatments of a KTP laser, that target group achieved a 60 to 70% clearing, which is pretty cool on average. Another study out there using the ADVA, which is a pulse dye laser with a 589 followed by a 1319 nanometer wavelength. After just 1 month, 72% of the subjects in that study had a greater than 75% reduction in acne count. And again, that could be through, in that case, the KTP is most likely targeting the oxyhemoglobin, that redness, and then, using that heating, right, to kill the C. acnes. With the ADVA, because we're using 2 wavelengths, the ADVA utilizes a 589 with the targets of hemoglobin and melanin, followed by the 1319, which is going to target the sebaceous glands. We might get a little bit better result because of that. We're using 2 different wavelengths and 2 different targets in that case. When it comes to your treatment protocol or your recommendation for that, generally we want to treat acne every 3 to 4 weeks. And then after 3 to 5 treatments, then again, once a year or twice a year touch-up is recommended. But I am super excited to treat acne clients using my ADVA. Okay, so we made it to the very last section of today's podcast. This section has to do with skin resurfacing and rejuvenation. In this section, our target chromophore is going to be water. What we're hoping to do is target water, and we can isolate different depths in the skin depending on our wavelength, but we're going to target water, and that is going to cause that water to heat up and cause damage to the surrounding tissue. What we're hoping to do is either remove superficial cells that might be pigmented or just need to be sloughed off to reveal newer healthy cells underneath, or if we're targeting the dermis deeper down, then that heating and selective damage in the dermis is going to create a wound healing response that will result in increased collagen production. And anytime we have more collagen production, we are going to have more supple skin. Wrinkles are going to be plumped out. It's going to be firmer, tighter, all things that our clients and us, quite frankly, we deeply desire, right? So there are 3 types of treatments that we can separate this section into. We have fully ablative treatments, partially ablative, or non-ablative. So what ablative means is, are we removing the epidermis or not? So a fully ablative treatment, an example of that would be a CO2 treatment. A CO2 treatment is going to remove the entire epidermis, the entire outer layer of the skin, and a portion of the papillary dermis, which is the upper portion of the dermis. That would be a fully ablative treatment. So the type of experience that would be, number one, ouch, that would really hurt. So you're, hopefully using some kind of anesthesia to perform that treatment. We are causing the total vaporization of the skin. Really, that's not appropriate for higher Fitzpatrick's. We really run a risk of that hypo and in some cases hyperpigmentation in our higher Fitzpatrick clients. But the CO2 was the first type of skin resurfacing and rejuvenation treatment that we use lasers for. And very quickly we realized that there were less aggressive ways to go about this that would still give us really good results. But let's say that you did go in and you had a fully ablative CO2. I have heard a treatment philosophy in many dermatology practices is that if you have a history of skin cancer, you have accrued lots of sun damage over the years, and it seems like every month or two you have a new precancerous or cancerous lesion popping up on your skin. Many of these practices are recommending a fully ablative treatment like a CO2 laser, because if you are simply removing all of those cells, you are also removing those malignant cells that are kind of lingering and lurking until they start to reproduce and then actually cause a lesion that we can notice, right? So if we're just removing everything, the philosophy anyway is that you're going to reduce the reoccurrence of skin cancer. What does that look like though? So I have seen a picture of this. In some cases, the skin will actually look like a burnt marshmallow. I mean, it is burned, it's going to feel like that too. And so in a few days, your skin is entirely going to crust. It will turn dark brown or black, and it will all slough off and kind of crust and crumble off. You would need to use a very heavy ointment, like Vaseline or Aquaphor, all over your face. You need to really watch for signs of infection, because infection is common with this type of treatment just because of how large that treatment area is. It's amazing though, the skin is going to regrow in as little as 7 days. So if you're young and healthy, your skin is going to regrow faster. If you are more elderly or you're not as healthy, it's going to take longer. After a CO2 treatment, though, on average, you will have regrown your skin, usually for most patients, within 10 to 14 days. And then what's left behind is going to be this new glowy baby butt smooth skin. Your signs of aging are going to be reduced. Hyperpigmentation is going to be reduced. And then again, if you do have a history of lots of sun exposure, then that also will reduce apparently the recurrence of skin cancers. So one of the more popular types of treatments that's on the market today is what we call a fractionated treatment. The first type, or the first device that launched with this philosophy, was the Fraxel. So you might have heard of that. The idea is that we are, instead of treating the entire field of that treatment area, the entire face, all of that tissue, we are instead treating selective little columns within the entire field. So we're using columns of light energy to create almost like a dot-like pattern on the skin, leaving untreated tissue in between. The idea is that by doing that, you're still getting the rejuvenating effects of a resurfacing treatment, but you're not having as much downtime, less risk of infection, not going to create quite as much trauma in the skin. Of course, with a fully ablative CO2, you're kind of one and done. You don't need to do a series of those. Generally, you get one of those and you're kind of good for life, maybe two. I haven't heard of many people getting more than one or more than two of those types of treatments. But with a fractionated, you're going to kind of settle into that common recommendation you've heard me say, the 3 to 5 treatments, and then maybe 1 or 2 per year after that, just because we're not as aggressive with it, right? We're only treating, we call the micro treatment zones, just little columns within the entire field of the skin, almost like microneedling, right? Microneedling, we are not needling every single square centimeter of the skin. We're only selectively putting our needles down to treat small sections of the skin. Kind of the same philosophy here. Fraxel uses 2 different wavelengths. It uses a 1550 nanometer. That actually is going to go deeper. That's in the what we'd call the infrared wavelengths. That's going to go deeper into the dermis. It actually bypasses the epidermis altogether, those infrared wavelengths. So it's not going to cause resurfacing at the surface, but it's going to heat that tissue in the dermis, which will cause some wounding. And that's what will generate collagen, which will plump out fine lines and wrinkles, tighten, lift, do all of those things that we love. But the resurfacing aspect comes in with the second wavelength that is a part of the Fraxel, which is a 1927 nanometer. This one is going to be more superficial. This goes in and it's going to target the epidermis, and it's going to still target water. So both of those wavelengths target water, but in this case, it's going to target the water in the epidermis. Using a pulse. It's going to target those epidermal cells, and that is going to cause that vaporization, that heating, which will cause tissue damage in the epidermis, and you're going to have that sloughing. similar honestly to like a peel where you're getting rid of that skin. So you have both the non-ablative component, which is the 1550, that's bypassing the epidermis, just causing that selective damage in the dermis to stimulate collagen. But then you're also with a 1927, you're actually going to do some resurfacing at the surface. So that is what's going to help with pigment and textural issues that we're finding more in the epidermis. But again, because we're not treating the entire face, we're just doing those little micro treatment zones, the downtime is going to be less. But it's funny, when you actually see people that have received this type of treatment, they will have these little brown dots all over their face. And it's kind of necrotic tissue that has died, and then needs to slough off. Not quite coffee ground look like with IPLs or other laser treatments, but yeah, you definitely don't look cute after receiving a Fraxel. And then another brand that you might have heard of is the Clear and Brilliant. That's actually the same company that makes Fraxel, but it's less intense. So we have two different wavelengths here. We have the 1440 for that dermal heating and collagen stimulation. And then you have the 1927, which is going to be, again, that more superficial resurfacing. But this one apparently is going to have less downtime than the traditional Fraxel, but get really great results. So this would be for someone maybe with less advanced signs of aging, maybe someone that wants more preventative rejuvenation, someone in their 30s or 40s, as opposed to someone that really wants to turn back the clock. Then we're looking at maybe performing a Fraxel treatment, which is going to be more intense. Another one that you might have seen out there is Moxie. Moxie is made by Cyton, the makers of the all popular BBL Hero IPL device. So Moxie also uses that same kind of micro treatment zone. We're only treating, selective columns within the tissue. But Moxie only uses the more superficial wavelength, the 1927. It doesn't have that infrared, which is going to go into the dermis. So the Moxie is going to target those more superficial epidermal cells, which will help with pigment, textural issues. And, generally because you are heating it, you will also see some collagen production. So just because the Moxie doesn't have the infrared also doesn't mean it's not stimulating collagen. But anyway, it's just using one of those wavelengths that the Fraxel and the Clear and Brilliant do. And then the last type of treatment within skin resurfacing and rejuvenation would be the non-ablative. So we talked about fully ablative, that would be like a CO2. Partially ablative would be like Fraxel, Clear and Brilliant, Moxie, where they're only removing certain parts, little tiny microzones of the epidermis. And then we have non-ablative, where the epidermis is going to be bypassed completely. Our wavelengths have been chosen to bypass the epidermis, go straight to the dermis, where the target is still water, but we're going to see some heating and some selective damage down in the dermis, or sometimes people call that bulk heating. And so that heat is going to damage tissue there, which will then stimulate that wound healing response. And that is what is going to create collagen, elastin, give us more of that plump, glowy look to the skin, tighter skin. If you have those atrophic acne scars, this might help with that by stimulating collagen. And so what we're looking at here in terms of wavelengths would be 1319. So that's the dual wavelength, the second wavelength we do with the ADVA treatment in my practice. We have 1320, very similar, 1450, or the 1550. So those are what we call infrared. So they're longer wavelengths than visible red. And again, they are selected because they bypass the epidermis and go straight to that dermis where they cause heating. And that is going to have that wound healing response that will result in collagen production. Thank you so much for joining me today as I went through a large portion of the types of laser treatments and light therapies that are out there. You wouldn't believe it, but I just scratched the surface. There are so many things out there, so many more things yet to come. This is an extremely exciting field, and I myself am so excited to have just joined this industry with the purchase of the ADVA TX for my practice, Grove and Kane. And so I am at the very beginning stages as a practitioner with a laser. Right now, my focus is to learn and to practice and hopefully launch this treatment officially in my practice in a month or two. But anyway, thank you so much. And let me know what types of topics you guys would like to listen to. So definitely email me. My email is karen@groveandkane.com. And let me know what you like or any suggestions for how I can make this podcast better. Thank you so much, everyone.